Hello and welcome everybody to the panel discussion that we are running at ThinkTree here this afternoon, this morning even, well, it may be the afternoon where you are. Okay, we will get there. Okay. So again, we're running it from ThinkTree. If you don't know us, we're a professional association, but we think we're more than a professional association, and we offer a whole load of benefits, membership, insurance training, quality assurance, CPD, and most of all, support for the industry. And this is what it is about at the moment. And this is the first of a series of support that we're going to be giving for people in the wellbeing industry. So keep tuned to our Facebook page for latest news. Quick disclaimer, this webinar does not provide medical advice. It's intended for informational purposes only. It is not a substitute for professional medical advice, diagnosis or treatment. Never ignore professional medical advice in seeking treatment because of something you have read or heard on an unofficial site. If you think you may have a medical emergency, immediately call your doctor or dial 111 in the UK or your local emergency number. So this webinar is also aimed at qualified and experienced therapists, so please bear that in mind as well. So our panel, we're very lucky to have a fantastic panel this morning. I keep on saying this afternoon, I really don't know why. We've got Jane Lawson. Jane has been a clinical aromatherapist for over 25 years. She's been teaching aromatherapy for 17 years. And her teacher was also taught by two of Marguerite Maury's former students. And it was Marguerite Maury who really introduced aromatherapy to the UK. And then we have Jennifer. Hi, Jennifer. Jennifer is a university lecturer in healthcare and director of JBH training. So she provides a wide range of holistic spa and beauty training courses to the UK and international students. She's particularly passionate about education, therapies, and integrating evidence-based practice into mainstream health and social care environments. And then we have our panel chair today, Kush, who's also CEO of ThinkTree. Hi, Kush. Kush has got a huge background in therapy. He started doing Indian head massage at some really, really teeny, tiny age at his grandfather's knee. He'll tell you that if you ask him. But he's also got a huge background in education. He's written and delivered qualifications for universities, awarding organisations, and worked with Ofsted. So he's regarded as a business expert and influencer worldwide for health and wellbeing. Then we have myself. I've been involved in wellness since 1998. I have been the secretary of the Reiki Council, which is the lead body in the UK for Reiki, and I also sit on the PSB for aromatherapy in the UK. Then we have Ruth. Hi, Ruth. Ruth is joining us from Australia, but she was born and educated in Zimbabwe. She has a master's degree in health and homeopathy, as well as qualifications in reflexology, massage, and aromatherapy. She's also got a degree in philosophy and literature and is an integrative health consultant and author who's been working in natural health since 1999. I think that's all of us, isn't it? Yes. Okay, if you're watching us live, and some of you may not have used Zoom before, perhaps, if you look around at your menus, you'll find that there is a Q&A button. You may have to navigate to the top to get it to appear. If you're on iPad, again, you might just have to pull it down at the top, same for your phone. And just see a little Q&A button. So we're going to have a little bit at the end where you can ask, you know, specific live questions. If you can just press the Q&A button, put your question in there, and we will answer it at the end. If that really fails, then look for the chat box, because the chat box is really easy to find and we can take them from there as well. There we go. And I am now going to hand over to Kush. to
Hello.
lead the discussion.
Hello, and welcome, and thank you very much, everyone, for joining us, particularly our panelists who are made up of subject matter experts from the industry. So a pleasure to have you all on board here. Obviously, we have been hit with this pandemic. We know that it's global. We know that it's having an effect on everybody. And the idea of us getting together today is to have a short discussion and is to speak to our experts, but also to try and guide and advise where we can. This is still our own accountability. We still are responsible for whatever action we take. However, we do need guidance and support where we can get it. So we have already gathered some questions together. We'll be answering individually, and then we'll have a short discussion, after which we'll have some Q&A. So my first question comes over to Jennifer. Jennifer, how do we then protect ourselves and our clients? What kind of advice would you give?
Yes, so in this troubled time, I think it's important for us to be prepared ourselves, and also if we run a salon or a clinic working with other professionals, ensuring that we're all aware of the local government updates and information which will help us direct our action. If we can use our social media channels to inform clients about what we're doing. So for example, we could provide information or videos to them about our cleaning regimes and about the local information advice for the area in which we live. And I think therapists are really well placed at this point, because a lot of the action that we need to take, that's something that therapists would already be doing on a day-to-day basis, such as the hygiene rules that we're following. It may just be that we're stepping that up in light of the pandemic. But I think if we're following our local guidelines, we need to make sure that, as well as when people perhaps ring or book and we ask the normal questions around contraindications and around allergies, that we're also asking them if they do have any of the symptoms, and if so, to stay away for the appropriate time. So for example, in the UK at the moment, that would be 14 days. And the same thing would apply to staff. So again, being prepared, if you do have employees, be aware from sort of a HR perspective of the rules and regulations that you must adhere to in relation to this, whether it be sick pay or having them do other duties from home. So for example, perhaps creating social media posts for you at a distance.
What about those that are over 70? Because we've been told here in the UK that they have got to isolate for quite a while. What if they're one of your clients? Is the advice the same? Is it different? Do we follow guidelines and say, I'm sorry, I can't see you?
Yeah, so for the over 70s, or those are in the vulnerable categories that have been issued by various governments, what I'd suggest is that we actually keep in touch with those. So telephone them, preferably, or using the other channels of communication that we have, just to notify them about their appointment not being able to proceed, but making sure that we're saying that again, as we always do, in an appropriate, friendly, calm manner. But also, I think this is a time where we might be quiet with our treatments. So actually giving that little bit of extra attention to our clients to, you know, look after them and look after our local community is going to be brilliant. So I would advise that therapists also, perhaps in that conversation, check if they're okay generally. So perhaps maybe asking, do they have a friend or a relative nearby who can do shopping for them? You know, if they don't have social media and aren't aware of perhaps local support groups within their town, that they can put them in touch with somebody. In the UK, for example, there's charities such as Age UK, which have lots of helpful information and referral service. And also for anybody with any other medical conditions, again, signposting them to the local charity groups in the area. But we can also perhaps provide a service, if possible, through befriending, so telephoning them. So maybe offering to telephone the clients once a week just to see if they're well.
Okay, excellent. Jane, Ruth, would you like to add anything to that? Is there anything that you'd like to add to what Jennifer's saying here?
Yeah, I actually went to my hairdresser the other day, and she has an autoimmune disorder, and she lives with her mother, who's, I think she said she was 76, who also has an autoimmune disorder. And my hairdresser has to keep working because it's, you know, she owns the company. It's a small business. She owns it. And I was chatting to her about what she's doing, and I was actually so impressed. And I think a lot of therapists can do the same. She said she's minimizing the number of people who come in at the same time. So she, instead of having numerous, I don't know what you call them, people who cut hair, hairdressers in the room at the same time, she's having one person at a time. She's having one client at a time. So she's minimizing the risk straight away. She wipes down her surfaces after every single client. She's got, I was very impressed with this, she's got rid of all her magazines. You know, often in our waiting rooms, we have a lot of magazines, and you can't disinfect those between every single person. So she's gotten rid of all of them, asked her clients to just read their phones, you know, read what they want on their phones. So it's very small changes like that, which I think have a huge impact, because we need to remember how the virus is actually spread. It's spread through droplet contact. So we actually need to have physical contact with droplets of, you know, respiratory droplets to actually contract the virus. It's not just floating around in the air ready to pounce on us all, which I think people tend to think. So if you have a small business and you have to keep working, then hygiene. And I think it can make a huge difference. Also, just for doctors or homeopaths, toys in your waiting room as well, those should all be put away so that little kids can't keep touching those. Yeah, I think, and the other thing was closed bins. I know a lot of therapists have waste paper bins that are easy to chuck your waste into, but you actually need a bin that's closed so that you're disposing of that rubbish properly. So if we need to keep seeing clients, then you've got to take your hygiene to like the utmost level. And it's the small things that we need to think about.
That's some really good advice there. Jane, anything you'd like to add to that?
I can't back up much more than Ruth has already said, actually, there with those basic procedures. Yeah, you know, we're all having to just raise the bar, aren't we?
Yeah.
You know, and the idea of keeping mind surface is what are people going to touch, you know, and limiting, like you said, with the magazines, anything that's tempting the client to go and touch something, get rid of it, just get it out of the way.
I guess that also includes the door handle to come in and out of the...
Well, one thing I was thinking of this morning was, you know, if you've got doors that you can actually leave ajar, whereas normally you'd be, you know, people be closing and opening and closing them all the time, you know, wedge them open and put a little notice on them. This has been left open for your safety, you know, or whatever's appropriate for you, whichever country you're in. This is one less surface somebody's, you know, not going to touch.
Actually, on that note, just thinking about, in some places, I know some people have these things at home. They have infusions, or they have the. Is that a good idea, a bad idea, or is that irrelevant? Jane's giving me that look. So Jane, do you want to take that one?
Right. What I'm going to say at this stage with this one, for general practice out there, if you're not already an aromatherapist, because obviously we're covering a raft of therapists out there, please do not go start copying any blends that somebody's putting out there on the internet, because all the ones I'm seeing are completely inappropriate. They're highly dangerous in many cases. You know, we've got this business at the moment, is or is not we take ibuprofen because of the inflammatory condition, etc. many of those oils, most of that I've seen of the blends that have been put out there are inflammatories, and that's not the way you need to deal with, but that's maybe for something else at another stage. So if you're seeing, you know, if you're other than, if you're like an aromatherapist, then please contact your local aromatherapist who can advise you and guide you about if you want to start. I mean, we're doing it where I am. You know, we've got sort of a shared office space, if you like, for what we do. So the first thing when I went in the other day, she said, "Do we put the burner on?" And I went, "Yes." You know, but it was all to do with who's coming in and out. It has to be safe. So in a general environment, contact your local aromatherapist and they should be able to guide you with, you know, diffusing into the atmosphere, because yes, absolutely. Well, being aromatherapists, I'm bound to say, aren't they? They're going to work. They're going to help.
Is there anything else you'd like to add? Obviously, the next question just moves on to that as a camp therapist, about managing the COVID-19. Any other guidance and advice? You've talked about the burners. Anything else that you think is relevant?
I've got to come from being in the therapist mode here into general stuff, haven't I? Yeah, you can use the diffusers, but make sure you have checked with an aromatherapist that they are absolutely safe. Yes, there are ways, obviously, within an aromatherapy practice. I mean, I've got it going on where we've made up stuff where we're actually using that, because obviously there's a shortage of disinfectants and everything out there as well now. So yes, we're putting it out there within my student group, obviously, a blend that we can use, add it to floral water, use it as a spray disinfectant, use it on your hands, use it on, you know, even on your face. It's quite safe to spritz your face with it. So if you have touched your face, then you can, you know, so yeah.
Okay, so just around that, we've just got a question that's coming from Marianne Wilkinson. I think the question on many people's mind is not how to stay hygienic. We already know this, okay? The question is, how do we stay afloat with cancellations and many less clients coming through the doors? So would anybody like to take that question?
I'm happy to respond to that one.
Okay.
So I think the first port of call is to keep an eye on what any professional bodies that you're a member of are communicating to you, and that might involve your insurance as well, to see what you are and are not covered for within your insurance, and then the local government as well. Are the local government putting in anything into place for small businesses or for sole traders, depending on which you are, to be able to support you within this time? And also thinking about other bills and outgoings that you have. So for example, business rates, speak to your local council. Mortgage rates, again, speak to your bank or your lender. So there are a number of financial issues you could talk more widely to the organisations that particularly work with you. And however, in relation to maintaining the business and the income, which was, I think, the original question, some suggestions that I'm making to sort of students and therapists locally to me are things like thinking about your retail side of your business. So for example, do you retail any products? So can you order these in for clients so that you can just drop them off either outside people's doorsteps and just tell them that, you know, text them saying you're outside or ring them saying that you're outside, just dropping it off? Or is it something that you can order into store, and perhaps they could just come to the doorway and collect order from you? So there may be some product side of your business rather than the hands-on side to your business, perhaps, that you can have a look at. And if you do anything which is a talking therapy, do consider things like this, things like Zoom, WhatsApp, FaceTime, Skype, telephone. You know, perhaps some of your clients haven't got internet access and they can use telephone. So is there some of your talking therapies that you could actually provide as an online service instead? So yeah. There are a number of
sorry, Jennifer, on that note, just a word of caution. Just be aware, and I think you're going to go to the ICO website to find out whether the platform you use is safe, covers all the data protection, and it's not going to get, we need to know that these things are secure when you're talking with people. Sorry, just going back a stage, we were talking about the standard advice from CAM, and Jane's already talked to us about aromatherapy. Ruth, have you got anything to tell us regarding homeopathy?
Yeah, it's difficult to make any suggestions regarding homeopathy. I think a little bit like going along Jane's lines is people need to see professional homeopaths if they are ill. I can't give generic advice about it. And in terms of practicing homeopaths who are worried about their business, luckily with homeopathy, there's a lot you can do. So you can do your consultations over Zoom, but it does also depend on your country and the laws for that. Like I know in South Africa, you can't see patients over Zoom. So you do have to check out with your governing body for whichever country you're in. But you can do a lot of consultations online. And I think just generally for complementary therapists, an idea that I was just thinking about to try and help yourselves as businesses is if a lot of people are stuck at home, then small educational webinars for your clients. You know, if you are an aromatherapist and you can't actually see your clients in person, or a massage therapist, and you have a good client base, you could do small videos for them on not overstepping the lines of teaching people stuff when they're not qualified to practice it, but for example, of mindfulness or how to de-stress. So it's keeping that sense of community and that sense of connection with your clients, even if you're not seeing them face to face. And you can charge a nominal fee for it so that you are making a little bit of money, and hopefully you get bigger numbers of people watching the videos. It's just a thought, like if you are a beauty therapist, you could do little seminars for your clients on skincare routines, what to do at home, or makeup ideas, something like that, just to keep people. I think it's important to try and keep your clients with you, to remind them that you're still there, even if they can't come to you in person. So you've got to keep that connection and that relationship going.
I think that's some good advice there. I guess some of the therapists that we have.
Sorry, can I just interject with one thing, please? Yeah. It's something that Jennifer mentioned earlier about product. If you are supplying something, and obviously coming, for example, from this, from an aromatherapy point of view, and we're going to see a lot of that anyway, just be very, very, very careful. It goes without saying, and we all know it within the industry, but, we get snowballed along with stuff. So even if you're going to put stuff out on social media that you have a product, we all know it. So I just want to reiterate, please do not make any medical claims, as we know within the profession. Do not say even that this is for coronavirus.
Yeah. No, that's really
about the ailments that this can help, but do not link it whatsoever. I mean, I did a post about the blend I've come up with, and I just made sure I did not mention it specifically.
Okay, so I think one of the concerns we're going to have, and I can see some questions coming up now, those therapists that are only do practical routines, and they haven't got retail, they haven't got things to sell. Yes, we can keep in touch with them. We can offer some guidance. We can offer some sort of little easy to do routines that can help themselves. But how are they going to manage? What can we do in that respect? Is there any advice or guidance we can give them?
So I think some of the time we self-employed individuals can sometimes find that we don't have time to perhaps sort out receipts, our product orders, do our stock take properly, those sorts of financial matters. So I know that some therapists are taking the opportunity to get their business into order so that when things do pick up again, they're in a really strong position to know which direction their business is going in. So for example, they're looking at future planning, future forecasts, perhaps the direction in which they want their business to go, and also using social media, things like Hootsuite, by putting in promotions that perhaps are for Christmas time, but they're actually taking the photographs now, working out with staff what their promotions are going to be, and inputting these into these portals and setting the date perhaps for December. But again, it's work that can be prepared so that those messages are fired out when things pick up again. So sort of being prepared for the future really, and having a really good solid foundation to build upon.
I guess people could think about retailing their vouchers, but they've got to be open because we don't know how long this is going to go on. But yeah, there's it's hitting people in different ways, and those who are doing just practical, I think they're going to have a bit of a challenge. However, there are other ways, and let's not forget that there's a lot of mental health concerns out there. And that still remains. And those in isolation, those who are of a certain age or a certain disposition, how do we help them? That might be a phone call. That might be some guidance and advice. And Jane's putting her hand up, so she's got something to say. Jane?
It's just going back to my Grenfell days where we worked as a team.
Yeah.
So it's just a mad, but I think it's very, very feasible and very, very doable. If you've got a group of therapists that you're familiar with within your area that cover all manner of different things, okay, it's worth getting together, connecting, and maybe have some sort of referral scheme going on. So for argument's sake, I could obviously send out sniffy sticks to people or what have you, but maybe a physical therapist who's only doing sports massage, salons shut down, clinics shut down, not working, but they're still keeping in touch with their clients, giving them ideas of what they can do. If their clients ask for something more specific, perhaps a referral scheme can be set up so that, say, for example, a sports therapist contacts me and they say, can you contact this client? I will then say, yeah, for that client, they buy product off me or whatever it's going to be, I will give you X amount. So you start getting the money starting to go around amongst the therapy fields in your local area. Am I making sense there? Do you understand what I mean?
Brilliant idea.
Yeah.
I think that's a brilliant idea. I also just was thinking for therapists who are mainly hands-on. I mean, I for many years was a massage therapist and reflexologist, and so many therapists suffer from burnout. So many therapists who every day are using their hands, working with clients, they end up exhausted. So I know no one probably wants to hear this, but maybe this is a chance to actually rest a bit, to, if you're not so busy, to actually just take a break and rest and go for some walks in nature and give your hands a break and work on yourself a bit, because this will pass. Things will go on. We will get busy again, maybe in different ways. And you need to have your energy and you need to have your strength. So this is perhaps a chance to hibernate a little bit and look after yourself as a therapist.
That's a really good point there. And you're right, because therapists do work very hard. Not that anybody else doesn't. But it is a good time for reflection. It is a time for kind of self-healing, if you like. However, I know lots of therapists will be anxious because this is their living. Rosemary, you've got something to add about Reiki, have you?
I'll add it about that. They're just, I've put in the chat. If you look in chat now, I've put 2 numbers in there. There is an HMRC helpline for business. So if you're in the UK, at least, if you ring 0300 456 3565, that will give you advice and any benefits you can claim at the moment due to problems and any other business support that is in place for you. So that's 0300 456 3565. And there is also a coronavirus helpline if you've got a tax bill coming up which you're going to struggle to pay, and the number for that is also in the chat. So have a look down there, note it, and particularly those who are feeling my bookings have all just disappeared, I'm really struggling, phone the number and see what help there is there for you. That's the most practical advice we can give. I have got stuff to say in terms of Reiki. So there's a good number of physical therapists who have Reiki who don't maybe necessarily promote it. But one of the things that we can do to support clients, particularly clients who are vulnerable. I mean, what concerns me are vulnerable clients who are now maybe either self-isolating or not able to get out with ongoing health problems, is that we can at least offer them distant Reiki sessions, whether that is live via Zoom, via WhatsApp, so you can, talk, chat, take a consultation. I would encourage you to consider letting your clients know that you can continue a practice even if they can't get out, or maybe you can't get out because you as a therapist have got ongoing health conditions, which a number of therapists have. A number of therapists are older and do have underlying health conditions. So there is a chance there, although I totally agree with Ruth that it from the bright side of things, even though it might be really difficult from a financial point of view, to actually go, well, let's look at what it is going to give me. Me today, I'm going out for a run this afternoon. Why not? I'm not on lockdown. I'm in the UK. In terms of Reiki, in general, so again, I'm talking to people who have Reiki. So one of the most useful things that I've always found, if I'm coming down, apart from using aromatherapy, obviously, Jane, is a little technique called Heso Chirio Ho. And a lot of you might know it, or some of you might not know it, but it really involves your middle finger. I'm not going to stick my middle finger up, even though that would at least lighten the atmosphere. But taking your middle finger, and once you've activated Reiki, putting it in your belly button. Now, I know that might seem strange, but I've personally always found that that's extremely effective if I feel I'm going down with something. And if somebody is incredibly can do, which requires, however, so indeed, if you've got clients who are something you have thymus.
Banging that for 30 seconds every day, it stimulates your immune system.
Yeah. So totally. So we've got belly button, literally middle finger belly button, really. If you've got clients who are really, really weak and sick for any reason, and you can obviously do this distant healing, one hand on the dantian, the tanden, and one hand on the forehead. And holding that position, I've found really, really helps people who are weak, physically very, very weak. I know, Jane, we've been talking in other discussions about where we think the virus hits the body in particular. So if you're doing self-treatment, again, if you've got time and you're not self-treating every day, you have the time to really give yourself full self-treatments at the moment. And because of our discussions elsewhere, I would say the head positions, the standard head positions, are so important. And particularly, I've been noticing the crown of the head, which ties in very much with discussions we've been having elsewhere, doesn't it, Jane? Mm-hmm. Yeah. And And obviously then if you're doing distant treatments, just think on the parts of the body which are being affected and aim your treatments specifically at them, such as the lungs, such as the respiratory system, such as the nose, any entry points. That's really what I have to say.
Okay, thank you for that, Rosemary. What about these therapists who have got to isolate for long periods of time? I mean, we've talked about how we can possibly support our clients. What about each other? What about as therapists? How do we support each other? There's lots of government help. We don't quite know what. We don't have the intricacies of that. However, we've given out some phone numbers for you to contact people. And I guess there's lots of concern from therapists who work on a daily basis, are all practical. All of a sudden, they've got to self-isolate. And it could be up to however long. How do they pick themselves up? What are the challenges? How do we overcome these challenges of the mental state of mind that they are not supporting themselves or their family?
I think we need to bear in mind other therapists who are in our locality that we may know, or reach out to ones that we're aware of. So it might be a Facebook group or a chat, maybe an online forum. For example, for my students, I'm putting on a Zoom meeting similarly to one later on tonight, just to touch base with people, because I think people sometimes don't want to speak up and say that they're struggling or they're concerned, and so actually reaching out and providing that olive branch to people, you know, that's really supportive, and hopefully they would take up that offer. And also practical support as well. So for example, if you've got therapists that live locally to you, you know, again, can you offer to do their shopping for them, or offer to drop anything round, you know, run errands for them if you're able still to get out. And also sharing of information. So if you know the course or interesting article, forward it and share it around. You know, don't protect information and don't think, oh, that therapist up the road is going to steal that idea from me. You know, at this time, if of any, that's where we really need to be clubbing together, I would say.
And can I also just say that anything that we do or try to do for others, can we please just make sure that we are doing this with the requisite knowledge and skill that we have, and we are following all the legislative government body lines that we should do. For instance, you know, if you are thinking of putting some online information out there, just think about, of course, GDPR, think about the information you're sending out, who you're sending it out to, get their permission. Make sure that you are insured to do this, in terms of if you're giving them any information other than what they already know. So for instance, if you're teaching them any new skill, make sure that anything that you do is approved or accredited, so that, you know, there's quality behind there. Because what we can't do is send a load of information out, and then if something happens to anybody, then you're liable. So just make sure you've got all your, you know, I's dotted, T's crossed. We are going to be putting on another webinar next week for course providers, and giving them some support around how they can offer some other means online of information, or setting up theory courses, or however through Zoom. We're talking about Zoom a lot because we're using Zoom, but we also know that that's a recommended platform as well. So just be aware of all of this. And can I just move on to kind of long term? You know, this has come into effect. We don't know on a weekly basis what's going to happen. But naturally, Jennifer, as you mentioned, there will be a peak, and there will be a gradual drop. I understand that, and I hope I'm right here, but I'm understanding that some hospitals in Wuhan now that were set up for the coronavirus are kind of closing because they are managing this coronavirus. And that message, I don't think we can see yet because we're in the thick of it, or nearly in the thick of it. So, but as you say, inevitably something will have to shift, and it will come to, hopefully, it will come to an end. But in the meantime, this is about community, this is about network, this is about everything that we've talked about in terms of how do we keep in touch, how do we keep our spirits alive, how do we keep those who are going under, what advice, and that comes down to the sharing. So, you know, if you have got any information that is useful, that people can use, then that's something that I think we need to share and use, you know, use the various platforms that we can do this. I've seen a lot of information on social media, and you know, let's just be sure that the information we're giving out is bona fide as well, because you know, we don't want to make anybody worse than what they already are. In terms of positivity, what can we offer therapists? What can we offer clients? What kind of guidance and advice can we offer them? Hopefully we can offer them something. We're smiling, so there must be something. So, you know, what can we say?
Network with, you know, the local therapists in your area, you know, right across the board. Don't just isolate it, you know, like for me, for example, contacting other aromatherapists. You already know those. Find out about the other ones. Maybe set up a group, you know, on Facebook or something for local therapists. So, and maybe even make it a closed group so that they can actually go in there and say, okay, I can't do this anymore. Can I refer people who can help this person if I refer it, and start that referral scheme going, you know? And even if it's just £5 for a referral, it's £5 for, dare I say it, a pack of toilet roll. You know, it's something. You know, don't just think, oh God, that's it. I've already seen in the UK, there's a lot of therapists here already saying, that's it, they put it on Facebook, I'm shutting my clinic and da-da-da-da-da. Now that's all very well for therapists who, especially female ones, who are married, and there is still an income coming in because husband can work from home and they're actually okay financially. But then people like myself, for example, I'm a single woman. I've got nothing to rely on. I've got to go and start investigating, obviously, government guidelines and things like that. But at the end of the day, I have a duty of care to my clients as well. Absolutely. And my students. And I think because as therapists, we all come from the heart, that's the big conflict that we've got going on now. You know, how long do I keep going for, and how can I keep doing this? Yeah, because we care.
Yeah, and that's really important. But you know what? It starts off with yourself. So if you can't look after yourself, then you know,
exactly, you're going to be no good to anybody else, you know. Yeah. And it's a knock-on effect from that, isn't it?
Well, we've got you on, Jane. Jackie Brown has asked, can you go through the thymus stimulation again, please?
Yeah, it's just doing that with your hand, and then it comes from kinesiology, and there's, you can hear it's affecting my voice, and you can hear it doing that kind of thing. Just quite firmly, and just give it a bit of a punch for about 20 to 30 seconds. Once a day, and it'll help stimulate the thymus, which then stimulates, well, helps. I can't say stimulate because I don't want that to, because you don't want an overstimulated immune system either, or we're going to get into that. And I can never say it, the cytokinic, can somebody say it for me, please, Storm? I can never say that word. So you don't overstimulate it. And there's the other thing as well, you know, even for self-care for therapists as well, don't start chucking every single vitamin and mineral and echinacea and everything else that you can think of down your throat, because at the end of the day, you're going to overdose your system, and your system's not going to know what to use for the best. So again, you know, you can do the self-testing from kinesiology as well to see if you do need to take something.
And that's some really good advice there, Jen, about not overdoing it, because there are people offering, you know, take this, drink that, eat this, do that. Let's just remember.
Whoa! No.
Let's just remember that the body is an amazing thing.
Yeah.
And if we heal the body through rest, relaxation, but let's also heal the mind, because the mind has impact on the body. And this is where I think a lot of anxiousness is coming in, because we don't know what we don't know. We've got conflicting advice. We're told one thing, we do another. And because we don't understand it, we then create more concerns and more issues for ourselves and for others. So if we can tune into ourselves, if you can think about what does my body need, yes, it's a very harsh kind of situation to be in, and to say, okay, you've got a few weeks off to self-preserve, and I know what's going to come back, but I've got bills to pay, I've got food to put food on the table. Absolutely understandable. But this is where the government is trying, I believe, to help us, maybe not succinctly and the way we want to hear it, but that's all we've got at this moment in time. So I think it's very, very important that we think about ourselves. We think about nurturing ourselves. If that means quietly contemplating our future, then that's what we do. But let's not knee-jerk and react, because by reacting, we're going to cause more issues. Let's respond, let's take our time, and let's be mindful about what we do and how we do it. Any other kind of guidance and advice you want to give before we take any more questions?
Oh, come back on.
Also going to be thinking about other local businesses as well. So if you're not already a member of various local business groups across the different professions, it might be worth getting involved with those as well, because again, there may be generic help, advice and support which goes across any business. And also there are also opportunities arising for sort of IOUs. So for example, if you needed a product and a service from another local business, you could sort of pay forward you to say, you know, when we can meet face to face again, you'd pay for that item with the massage or whatever therapy. So that's an option.
Okay, that's quite interesting. Yeah. So people kind of, it's almost like the old system. Yeah. Okay. If we've got any more questions coming through, if you'd like to send them through now. I'm just looking at the questions we have. So there's a question initially about wearing masks and gloves, and even one therapist is using cling film over her couch. What are your thoughts on that one?
So if we think about infection control, the key areas we need to think about are, for example, our etiquette in regards to coughing and sneezing. So again, if you wanted to add additional posters, perhaps downloaded from the government, from the NHS, around coughing, sneezing into a tissue, and provide bins to dispose of those. So there's our personal etiquette. There's also, for example, the use of disposable gloves. So for example, if your treatment, you wouldn't normally be wearing one pair of disposable gloves per therapist. This might be something that you can start to do. And also plastic aprons. So again, perhaps those who do waxing or other treatments may be already using plastic aprons, plastic sheeting on the bed, and plastic disposable gloves, one use per client. But that's something that you could build into other treatments that you wouldn't normally use that for. And also doing a general risk assessment, so really stepping back and having a look at your room, your entranceways, literally every part of the building where there'll be traffic from members of the public, and that might be increasing the amount of times the toilets are checked, providing paper hand towels instead of a normal towel, wiping down the beds and changing all of the bed linen between each client, rather than perhaps the underbedding changed each day, and thinking where people are going to touch. So you mentioned door handles before, but there's also things like reception desks where people touch, or if you have mints or sweets in wrapped paper that you normally offer as a freebie, remove those from the waiting area so people aren't sort of putting their hands into bowls of food that other people are touching. And also things like spraying after each client the keypad. So even though contactless is great, sometimes you have to yourself or the client input the amount that they're paying. So again, making sure those are wiped over between each use as well.
And yeah, I mean, really good advice there. But again, let's also think about the plastic that we're using as well. So we're kind of caught in the middle of everything. We've got to be mindful about the amount of plastics that we use and how we dispose of them as well. Sorry, Ruth, you were going to say something.
Yeah, I also was thinking, if you are carrying on practicing, for example, giving massages or reflexology, hands-on therapies, perhaps it's a good idea to remind your clients the benefits of these therapies, the main one being that it reduces stress. And if you think stress is probably one of the biggest negative factors in immunity, it's one of the biggest immunosuppressants, is stress and anxiety. So if your clients are not infected, if they don't have a fever, if they're not sick, and if you're not sick, then why shouldn't they come for some treatments, for some good stress reducing treatments? And if you maintain top levels of hygiene in your practice, so there's not a chance of cross infection, you should be able to carry on as normal as possible and help your clients. They need it. This is the time that people need to lower their stress levels.
Can I just ask the panel, do you think there's a level of scaremongery here?
I do.
You do. Okay.
It's a viral epidemic. I mean, we've gone through so many over the centuries, and I'm sure we're going to go through many, many more. There's viruses. Viruses there's billions of viruses. They're the most, they outnumber any other cellular organism on Earth. They're everywhere. And our bodies are incredible and they adapt quickly. And the people who are at most risk are the elderly and the immunosuppressed. But the general, younger, healthier people, I think we need to try and carry on as much as normal with maintaining good hygiene and being very aware that that we don't want to spread it if we have it. But not every single person walking down the street has it. And you might be next to someone who has it, but you're not necessarily going to get the infection if your body is strong and can fight it off. So
Can I just say that about the elderly, though, because the figures are starting to wane the other way now. I think the elderly actually, because this is going back to, you said your PMA, basically, your positive mental attitude. The elderly are there. I've got elderly clients and they're going, I lived through World War II, all this kind of attitude. They've got a whole different attitude to it. And what we're starting to find with the statistics that are coming through now, it's all the people who are from about 40 to 60 who are actually, they're the biggest group. They're actually in ICU with this because they're the age group as well that are doing more of the panicking, that they're the ones that are getting, I've got children to think about, I've got this to do, I've got to get the shopping in and da-da-da. They're the people actually, and we're going to see it's shifting already. The older people, okay, if I'm going out with this virus, I'm going out with this. They're totally cool about it. They're not suppressing their immune system. Yes, they might have the underlying health, and if they're unfortunate to get it, that is why those are the figures that they are. But generally, I'm personally seeing this shift, and the statistics are starting to come through now. We're seeing it in the UK, where actually it's that I don't know what age group you want to call it these days, but something like the 40s to the 60s, they're the ones who are actually needing the medical care. And it's all down to they're the ones that have the responsibility and how am I going to put the food on the table and worrying about the children and childcare and school's going to shut and all the rest of it. They're the ones that are suppressing their immune system even more. This all goes back to your own PMA, and your PMA is something you've got to get across to your clients.
It is also, a lot of people, I think over 80% of people recover fully from it very quickly. It's not you know, if you are healthy, it's all about the terrain of your body. If you are healthy, you'll get viral infections and you'll recover. I think if you have the virus, then stay at home and rest, or get medical care if you have it severely. But I don't think we should be panicking to the extent that we're panicking. I think social media has a lot to answer for at the moment.
Yeah, and this was, you know, going back to the question, are we overthinking this? It's quite simple, I guess, in terms of, you know, how much we can do for ourselves, because there isn't a vaccine, an antidote or anything at the moment. But if we self-isolate, if we look after ourselves mentally, physically and emotionally, and that's not to say that we haven't got bills to pay, we haven't got other things to consider, but, you know, there's a lot that is out of our control, but there's a lot that is in our control, and we can control ourselves, we can manage ourselves. And it might not be something that, and I guess, you know, with guidance and support, we can help manage each other. If there's anything else that anybody would like to add to finalise where we are, Jennifer, you wanted to say something?
Yeah, I just wanted to support what you were saying there, in that unfortunately there is a lot of fake news, and it's very difficult for anybody to ascertain what's real from fake sometimes. So maybe before we press send or repost, perhaps actually considering where the information has come from and what we're sending out to our clients, but also as well thinking about perhaps limiting the amount of times that we do scroll or click through social media, because if every moment of every day we're constantly looking at people arguing or panicking or whatever else it may be, that's all consuming. Whereas if we can try and think about keeping our routine through the day, so perhaps maybe the ritualistic things that we do, brushing our teeth, having a shower, getting dressed, not staying in our pajamas, you know, those sorts of things, again, when you talk about mental health, they will help protect and support us, and therefore then you can help the other people in your life. And for example, you know, if you have got small children or other dependents who are unwell, again, not constantly saying that person's posted this or this panic news has come out, perhaps 1 to 2 times a day checking the television, the radio, the social media, but actually thinking to scale that back and think about honing back in on ourselves and using our own intuition rather than relying on the hearsay of what's out there, really.
And yes, and going back to what Jane was talking about, and we've all mentioned about the PMA, positive mental attitude, you know, let's just take some time and be realistic. Let's not react. Let's respond calmly. Let's think about our own mindfulness, and then maybe we can find a better way rather than causing our body to go into a panic. Rosemary, anything you'd like to add?
Just in response to, I think one of our listeners sort of said, do we need a certification for doing video talks or Reiki videos? And one of the things we're going to do next week is one of our trainers, Charlotte, is actually going to teach people how to use an online platform to continue to see clients. And that's going to be at 11 o'clock next Wednesday, so 1 week's time. So do look out for the link for that, and Charlotte will show you exactly how to run a practice if you're not too confident in it, you haven't done it before, etc. And I think also going back to some of the points that everybody else has made about keeping in touch with clients, I mean, you could simply have a simple online Zoom chat, you know, that they can hop on and have a little, almost like group discussion, because one-to-one's all right, but there is nothing like peer support. There's nothing like actually doing something positive in a group together. And if you are going to go on social media, as Jennifer says, start sharing something funny. start looking for the things that make people laugh, because we know there is nothing like laughter to help your immune system as well, and also to distract from the general fear and panic, which is just going to make everything worse.
Yeah.
And I'm going to be watching Bridget Jones if I watch anything.
Okay. No, listen, thank you ever so much to everybody giving up their time. For those who are watching, it's one of those where we're trying to find some support and answers. We're limited with the advice and guidance that's out there. We're trying to create our own, but if I can be very simplistic, take the responsibility, look after yourself, stay healthy. If you've got to self-isolate, then you've got to self-isolate. You can't fight a wave. You've got to ride a wave. However, whilst you're riding the wave, respond. Think about how you manage yourself and manage others. Be there for others through different means. We will be holding a webinar on Monday at 11 o'clock around for providers as to how we can help them. Offer some online training, offer some online advice and guidance. Charlotte is going to be here on Wednesday for those of you who want to try and keep in touch and maybe use some platforms like Zoom or anything else, and how you can manage that process without it costing you a fortune. That's the other thing. You know, there are means, but it doesn't always have to cost you a lot of money. And, you know, we will continue from ThinkTree. We will continue to put things up on social media, things that we've checked. We will continue to offer our guidance and support. If you are members of ThinkTree, then we have got under your incentives when you log in, we've got lots of information there for you to access. Please do that. If you're not a ThinkTree member, then please come and join us. But we will be putting out a lot of freebies as well, because that we feel that's our duty to do that. It's not about being selfish, it's about thinking about everybody else. So thank you ever so much. I think we've got a couple of things coming up now. Lockdown in Spain, and it isn't as bad as you fear. Okay, so that's Jane Bryan, who hopefully will be joining us next week, and she's telling us about what's happening down there. And, you know, if there's anything else that we haven't covered that you want us to talk about, then please send us an email at info@thinktreehub.com, and we'll be happy to kind of put something together. Because remember, we can, I think have we got stuck? Oh, there. If there's any other information that you need, then please come and talk to us. So thank you very much, and good health. Bye-bye.
Thank you.
Bye-bye.